I lied. I'm contemplating suicide. I said I'll get by. Oh, I tried. My hands and my feet don't move the same. This love will break this heart of mine. Even the greatest of soldiers need help sometimes. This storm will shake this house apart. Even the brightest of days need light sometimes. I said I'll get by. Oh, I tried, I cried. The tears on my face don't flow the same. I spoke to heaven, yeah, told them to ease my pain. The winds just got stronger, then the voice said, be brave. This love will break this heart of mine. Even the greatest of soldiers need help sometimes. This storm will tear this house apart. Even the brightest of days need light sometimes. This love will break this heart of mine. Even the greatest of soldiers need help sometimes. This storm will tear this house apart. Even the brightest of days need light sometimes. Even the greatest of angels need help sometimes. Kupendani vitendo, si maneno, yonakupa kitengo, kwa kufika malengo, umesipa mapengo, kwa upendo, upora zingo, hazini vikao vya sendo, maana, mrembo na kutuza, mama, nashukuru umekuza, chanda, mapete na kutunza, manama, eja wote kuwatunza, na umesha nzima, yo, majani ya udongo, yeah. Nje ya sayari nipita kimondo, oh. Kama chungu ya kibongo, na usiyape time ya kutibu wenyongo, no. Maana mrembo na kuchuza, maana nashukuru kumekuza, chanda chema pete kutunza, namba kuja wote wa burusi na umesha nzima, yo love, yo love, your love, your love, your love, your love, your love. Mama Jojo, Jojo langu wewe, mama kutikisa mitoto ndoka Jojo, mama Jojo, Jojo langu wewe, Jojo langu. All right, so let's do this. I will want to take this opportunity to welcome you all for tonight's session. Tonight we are hosting How are you? Kevin.
Hi, Patrick.
Nice to see you, man.
Nice to see you. How are you doing?
Good. I'm doing good. Right. So, Kevin, there is some echo from your side. I think you have. Can you maybe try to unmute a little bit? Okay, good. So that's perfect. That's good. All right, good. So, Kevin, so tonight we are hosting you in this show. So before we maybe go to this discussion, I want to mention to everyone who is watching this show, you can basically join in. You can just use the link at the comment box. You just click, it takes you in. You can ask any question to Kevin. Kevin is going to answer all your questions. Now, Kevin actually has developed a web tracking system for COVID-19, basically for self-assessment. So I'll want not to talk about it. Maybe I'm not a developer, but Kevin will give all the details. So Kevin, so you'll first do your quick introduction. Then after that quick introduction, I'll be bringing anyone who joins, ask you a question, and then I'll be also following up with questions. So maybe you can go.
Okay, thanks, Patrick. So just like you mentioned, my name is Kevin Oya. I am a health informatics professional. So what I try to do is to save lives through developing technology solutions for medical records keeping and also to analyze research data. So primarily, I am a software developer, but I tend to specialize in health informatics.
Great. That's wonderful. So before maybe we proceed, also I want Alphonse, who is also a panelist in this discussion, to introduce himself.
My name is Alphonce Were, a labor policy consultant based in Nairobi. Yes, and I've been in the show for various occasions. So, great. Kevin, welcome.
Thank you, Alphonse. I've watched some of your shows before.
Santi.
Great. That's wonderful. So, so for me, I won't be asking so many questions tonight. So first, Kevin, I want you to actually put us to speed about that self-tracking system you developed, and then we understand in just a layman's understanding, as well as you can tell viewers maybe how they can do self-assessment for themselves.
Okay. So I'm going to give you a brief history of how this came about. My organization and the people I work with are primarily medical researchers. So it's a team of health professionals, from doctors to clinicians to nurses and some tech guys like me. And when the COVID-19 pandemic hit, we quickly decided to find out if there is a way we could be of help or conduct some research and find out more about COVID-19. So because all that is still in the process right now and everything is still at the early stages, and I am the lead developer for the organization, I decided to put out a few things out there just to test the waters. And that is how I ended up adding to my personal website the statistics for COVID-19 so that people can see live data. And I also ended up adding a self-screening tool on the website. So that is a brief history of how it came about. And I have that on my screen right now, and I could share it with you.
All right, you can share.
Okay. So I'm just trying to switch. Hold on.
It's okay.
Okay, so I've shared it.
Have you shared? Can you share your screen? I cannot see from my side. Right. Maybe if you share your screen, it can be able to be seen by our viewers.
Okay, I'm trying to share it, but I think it's not coming.
I'm sorry. It was coming just a few minutes ago. It was coming, yeah? But it's okay.
Oh.
Yeah, it was there.
It was actually there?
Yeah, it was there, and then I don't know what happened. Right. I think we have lost Kevin. Maybe issue of network. Let me try to get him back. So, Alphonse, maybe you can weigh in terms of what Kevin has come up with before he comes.
Yeah, I think we need to encourage this a lot. And part of what we need to encourage around this is the issue to do with innovation and creativity. Yes, we need to encourage innovation and creativity, and I think Kevin's work is very encouraging. I want our viewers and ourselves to see it, then we comment from a point of knowledge.
Okay, good.
Yes.
So, so I'm sharing Kevin's screen. So that's his self-assessment website. Now, Kevin, just based on that, without maybe even using it a lot, just tell us, how does it work?
Okay. So at the moment, when you access the screen, what you are seeing immediately on your screen is a quick overview of the coronavirus pandemic in Kenya, the numbers of it. So you can actually see the statistics and how the numbers stack in Kenya. At the same time, you can also see a quick overview of the world statistics that lists the highest confirmed cases. which is in the United States of America at the moment, and you can see the highest deaths, which is also in the United States at the moment. And interestingly, we are having the lowest deaths that is coming in from Africa, and that is in Benin. So some people have been asking me a few questions about how I am putting in the lowest confirmed cases to be having one, or lowest deaths to be having one. Yet there are countries with zero confirmed cases, there are countries with zero deaths. And the simple answer to that is we are looking for lowest confirmed cases. So a country with zero cases necessarily actually that has no confirmed case. So it does not qualify here. And a country with zero deaths does not qualify here either. At the same time, if you look at the right of my screen, if this was on a mobile device, they get stuck down. You can see this button here for screen yourself. So when you click this button for screen yourself, it should be able to open for you a COVID-19 self-assessment screen. So in this self-assessment screen, it was a tool that we basically use the WHO guidelines, the very first one that were published. I have not revised it since then, to just ask you a few questions for screening purposes. So it is not a diagnostic tool. And I put that as a disclaimer here. So saying this is a COVID-19 self-assessment tool that was calibrated based on WHO
It's
guidelines.
working.
It is not a diagnostic tool. So now what happens here is that if we want to test people for COVID-19, sometimes it's not generally a good idea to go ahead testing everyone in the country. So we need a way of screening to find out which people are at most risk of COVID-19 and do something we call targeted testing.
Okay.
So this is why we have this screening tool for you to help you. So you'll be answering simple questions like, do you have a cough? And you say yes. Do you have a cold? And you say no. And are you having diarrhea? And you say yes. Are you having a sore throat? And you say no. Are you having body aches? Yes. Are you having a headache? No. So I'm just giving an example. So do you have fever above 37 degrees? Yes. Are you having breathing difficulties? No. Are you experiencing fatigue? Yes. Have you traveled during the past 14 days? No. Do you have a history of traveling to a COVID-19 infected area? Yes. And are you been in direct contact with a positive COVID-19 positive patient, or have you been taking care of one? You say whether it is true or false. And then at the end of it all, it gives you a basic assessment of your risk status for COVID-19. So the result here, for example, in this case, it has said your risk of COVID-19 is high. And then it gives you some little advice on what to do. So because this website was being accessed all over the world, and I've been getting hits from all over the world, there are people trying to call this Kenyan phone line, and it's not been working. So I had to just say here, I contact the local health department or authority, and then I had to mention specifically for Kenyans, call these toll-free lines. And these toll-free lines are working. They are from the Ministry of Health, and they're available on the Ministry of Health website. So it also tells you to please see a doctor immediately and do not panic. This is very important because people have developed some fear towards COVID-19. They don't have accurate information, and those are some of the gaps we are trying to fill. So at the end of this test, you can basically, just click on restart test, and it will start over again. So that is how this self-screening test works at the moment. And to be frank with you, I have received a number of comments from it. And I also received a call from Ghana, Accra. They developed, the government had a private contractor develop something very similar to this. And the person who called me works for a radio station in Ghana. and he asked me to help him compare what I'm doing to what the government of Ghana is doing. And we did that comparison live on, well, it wasn't live, but it was a personal call. We did that comparison, and they were basically doing the same thing I am doing, but they're using an app which people don't want to download. And it's better to leave it online, like on a website or something where people can use and leave it there, and they don't want to download it. But at the same time, they think it's some kind of a test, which is not true because it's simply a diagnostic, it's simply a screening tool and it's not a diagnostic test. So
Okay.
those are some of the things I wanted to mention. And people have also asked me if I'm collecting, personal information, personal data here. I do not. You've seen from the steps that I followed that I've not been collecting personal information because I did not have that authority to do so at the moment. At the same time, it's in my profession, and I am somebody who is, so passionate about electronic medical information, privacy, and security. I did not just want to go ahead and start collecting personal information from people. So this is something I put it out there to test the waters. And I've already received a lot of feedback from it. And we are forming already a work plan on what to do for the COVID-19. And I think according to the steps we've made so far, it starts in May, and that is just about 2 days away from now.
Okay, good, good. Now, Kevin, there's a question here. Maybe for a viewer, what is the domain name of your website? Maybe for that person who don't have the link, what name are they going to use?
Okay, so the domain name is www.kevinoyoyo.com/COVID-19, and I can you can see it right here. I don't know if that is visible.
Yeah,
I don't know how visible that is.
not very.
Or you can type it in the response.
Mhm. You can, yeah, true. We'll pin it on the comment box.
Let me type
All right.
it in.
All right. Good. So maybe now I'll want to bring it our panelists to weigh in on this development. Maybe we can start with a quick introduction from Conrad. Conrad.
Okay, I'm Conrad joining in from Busia.
All right, good. Wekesa, you can also introduce yourself, and then now we'll go to the weighing in terms of what Kevin is working on.
Okay. I am
Wekesa.
masked.
I think I'm having a little
I'm
difficulty
Wekesa with a mask.
You are with a mask.
I'm Wekesa with a mask from Masaku County.
All right.
I'm a sales and marketing specialist. Congratulations, my brother, for what you've done.
Great. Good. So now maybe I would want you guys to ask Kevin, and I'll bring another. There's another person joining to ask a question. First of all, let's get maybe a question going to Kevin from our panelist Conrad.
Hi, Patrick. I was having a little difficulty with my speaker, so please repeat the question.
Oh, okay.
What?
Sorry, guys.
There's some echo. I think I can't.
The echo is coming from who is that? Maybe is it Kevin? Kevin, you have an echo from your side.
And I understand that. I understand that. So I cannot do away with it at the moment.
Oh, okay. Let's okay. I'll try. Okay, let's try. So, Conrad, can you go with your maybe question or comment? All right, to Kevin.
Hello.
Yes, Conrad.
So My question, because I've looked at the app, I think is a good app on tracking of COVID-19, and that that self screening is actually helpful. So my question to him, I probably as he has alluded to it previously, and I was not privy to it. Is he adding more functionality to his? Is he
Okay.
adding more function? Is he adding more functionality, especially on tracking, especially in our context? Is he adding more functionality, especially on tracking of the virus through various counties or something like that, so that probably in our case, people can be able to know how far the spread is in terms of confirmed cases.
Okay, good. That's a good question. But before you answer that, George is saying hi from the US. Hi, George. Nice to see you. George is a medic in the US. I wish you could join us, but I hope if you can make it, you can just join us. All right. So, Kevin, you can answer that.
Okay. So I have to apologize because I am having a lot of rains where I am. It's raining, but I hope it doesn't interfere so much with the quality of the sound.
Yeah, it's okay.
But to answer that question, what we put there was I did it to test the waters, and I have already seen the pitfalls, and I have already seen what is probably going to work. So absolutely yes, we could use that for tracking purposes. What we would actually need is to collect some more personal information, things including contact information, things including address location. So some of those will require permission from the users to put in their address location. So the website might probably ask you that to allow the website to get your location, and you have to provide that permission so that we are able to know exactly where you are. And that is something that I feel that we should be able to do. At the same time, we should be able to collect contact information like telephone number, so that in case you are at high risk, you can be called and even traced. So that is something that we can easily achieve.
Okay, good. So maybe we can proceed to Wekesa. Wekesa, you have maybe perspective or any question in that regard from what Kevin has shared.
I think it's a good step towards what we are doing. My only fear is the Kenyan situation. You realize in Kenya, even when we did election, everything was right with the manual system until we went to the server. I think we are cultured not to give the right information. And actually, I've done like 2-3 surveys of the same. I don't, from some of my friends who are doing research, an application like this one. You asked question, then at the end of the day, you are told whether you are high risk or no, or such. But what I may think is that Kenyans may, most of that, like what is happening in government, with this forced quarantine, and the environment is so hostile that nobody wants to give information that can predict a yes or a high risk. In fact, someone was telling me that even most Kenyans who have been falling sick and going to hospital in this season of COVID-19, they are not going. They are even have pretended they are okay. They are trying to look fine so that they don't come near to contact with medical facilities. So how do we address those fears as such that we get the right information from the ground?
All right, good. Kevin, as you can hear, is talking about how our healthcare system is designed. People fear the hospitals or fear what will take them to hospitals. But how do we design something that actually alleviates people's pain as well as gives them reasons why they should use it because it's designed for them?
Okay, so for the exact reason why people fear going to the hospital, that is exactly the reason why we should use an app or something that is online, so that at least you can, screen yourself without having to go to the hospital unnecessarily. So by the time you decide to go to the hospital, it means you have seen for yourself that it's really necessary to go to the hospital. So that would give a better reason for some of us to actually go the digital way rather than find yourself in an hospital for something that you did not think would turn out to be COVID-19 related, but you just fear that if you go there, they're going to misdiagnose you or something. But if you do it yourself and you convince yourself that I am actually at high risk and decide to take the first necessary step to go to the hospital, that is better than post quarantine that you are witnessing all around.
All right, good. I want to go to Alphonse. Alphonse, we had this discussion before, whereby we are talking about our economy and our Kenyan terrain. Now, what Kevin they are trying to come up with, and what kind of law we have, and how does they protect them?
No, maybe before we go there, let's interrogate Kevin's product with an intention of improving it. I hope everybody can get me.
Yeah, clearly.
Okay, now I want to have a few questions, but answered before I go to the next one. So the first question I want to ask Kevin is, how is he fetching the data? Is the data being fetched, being inputted manually, or are you using some cron job functionality in any way?
Okay, Alphonse. So the data I am querying is actually from Johns Hopkins University. It is the live data as it is updated from all over the world. So what I am doing is using something called an API, which is a short form for Application Programmer Interface. So we are interfacing with the live data of coronavirus database that is funded by the WHO. So what we have on my website is what has been reported to the WHO from the various countries.
Okay,
Right.
I think that is well understood, and you have said it well. So my concern on that was because of if it is manual, then there could have been need for accuracy and timeliness. But when you are having an API from and you are fetching from John Hopkins University, I think that's a credible source at the moment, and that is credible job. So thank you for that. The next thing I want to know is when we are visiting this website, the general public, what do you want us to get from the website? What is the objective for the user, the general public as a user?
So the first objective for this website was to provide statistics, to provide data. And I had it in mind that it would only show Kenyan data. That is why I put Kenya as the default. So the moment you log in, you will see Kenyan data by default. And if you decide to see another country's data, you can just look it up and see it. And if you decide to see the worldwide data, you can also look it up and see it. But then as time went by, I added a self-screening tool or self-screening functionality, and that one brought a lot of interest, and people have been, taking interest in that. So that is, I've been having similar discussions with other people, and each time I get important feedback. Each time I get some good, positive energy that I should improve it, and maybe get the government to take it up, or the county government, the national government, whatever. But yeah, so those are all the discussions I've been having around, and the feedback is very, very welcome, and some of them might be a little overwhelming.
Okay, thank you for that. The other thing I want to now suggest is, because there are two modes of reporting. One, we have local mode of reporting, and the other one is the international mode of reporting. So the John Hopkins University or hospital, they are having their mode of reporting, which is almost what I want to refer to as the international mode of reporting, and part of it is what you have captured in your screen, or in your the information that you're exposing for the public. That is new confirmed, total confirmed, new deaths, total deaths, new recovered, and total recovered. But I'm sure that your product has an inclination or a bias towards Kenya. So having looked at your product, I haven't had enough time to go in depth, but I can see you have a page, the COVID-19 page, which is what the one carrying this. Now, what I'm thinking is that then, as one of the possibilities, is you can also create another page.
Just continue.
Let me wait. Okay. As part of improvement, is you can create another page so that those who are interested in Kenya specific mode of reporting, whether you'll be doing it manually or otherwise, because I don't think we have a system where you can fetch using an API. So that once an announcement is made, we want to know which county did we have these people come from. In that county, particularly Mombasa and Nairobi, which area, because we are already breaking them down into Dandora, Kasarani, Kawangware, yeah. So that data, whether if it cannot be captured in the manner you are capturing this, then you can put that as just as in prose form, so that we are able to say on 15th this what was reported, this is the data. But my interest is that data can be collected in a way that if I want to get what was happening on 1st of April, then I can just click 1st of April and I see what was announced that day. I think that will go a long way. However, being a project, you may be overwhelmed, and I'm not sure if you have the capacity in terms of people and other resources required, including finances, that can do that. But it's just a suggestion that if you can manage to have a Kenya-specific way of reporting also captured, either as a PDF or a prose, but the best will be interactive, whereby somebody can just click a date and get what was said in that date, or get an overall, by this time, this is how we were. If possible, draw the curve, so that if you put the data, the curve is drawn, so that some of us want to see the visuals.
All right, good.
Okay. Yeah, I lost you for a moment, but I think I can fill in the gaps. And day by day reporting of what has been happening since the beginning of COVID-19 reporting in Kenya is data that I have been trying to access it, and I think about last night I got it. So I'll be putting it live on the website, but right now it's not something that is published. It's just something that is sitting on my computer. And then I can do that, and of course, draw the curve as well, which is something that I can do when I have all that data. So it's something that I'm working on, and it's something that will be available. I think I will update you guys when it's done.
Good. Okay, my last thing is post COVID-19, and that's now my interest, because COVID-19 will go. I am certain, and now I'm focused on post COVID-19 season and period, and beyond my lifetime, beyond your lifetime, beyond the lifetime of the panelists who are here now. Now, what I'm looking forward to is think about this solution solving problems ahead. What can we address that we have been having a gap in the past, that COVID-19 has given you a chance to develop this service or product, that now going ahead, we can actually handle these. If it is purely on health and statistics of health, and maybe let's say HIV, we are talking of diabetes, we are talking of cancer, different types of cancer, we are talking of malnutrition. So there are very many things that are around health and other statistics that might be important, and there are different sources where you can get them that are authentic, whether it's World Bank, IMF, Central Bank of Kenya, but above all, Kenya National Bureau of Statistics, and any other credible source that you quote the source, and then we have this data kept in the system that when we come to your system, we will always be assured that that information can be found there. I think you are doing a good job. Keep it up, man.
Awesome. Right. So
And
Kevin,
maybe just to respond to that, I have been having that in my mind. I have put out a domain, a different domain for this work that will not be as personal as it looks. And of course, I've been doing some work with the National Cancer Registry for Kenya, which is reporting to the International Cancer Registry in France. So it is something we have in mind to build some dashboards for the cancer registry so that is public and people can see. So a lot of these will come into play, and I think in the near future, I'm going to publish a link that is less personal, that is away from my personal website, and it's going to be having all these different dashboards that people want to see. You know, in this information here, we are in is the information age. So data is the new gold. And this is what we are mining, this is what our life depends on right now. So I will be putting that kind of information out there, and I think that is in line with my objectives at the moment.
Okay, a quick and the last one at this point concerns the security of your websites. This one is a bit basic in terms of, I don't think the information is a bit sensitive, but you can still use the basic SSL certificate for digital and online credibility, but also just for confidence of the users. But above that, as you are thinking of the other major project that you are telling us in the near future, think of how to ensure that you protect that work, make it a source of your livelihood, so you can be guided. Even in this program, we can have a different session where we can get people who can help you out, so that you are not just doing it for fun, but it becomes part of your life. If possible, it becomes your main source of life and livelihood, so that you're able to feed your children, your family, and other dependents, and yourself comfortably while you're solving our problems as a society. But away from that, the SSL are different types, and I'm sure you know that. So you go with the high security firewalls will be very strong, because this data definitely will reach a point where we'll want to hack your site. We want to destroy you and destroy your work, and I don't think that's what you want us to do. So think about security, think about developing structures, and we can guide you on that at a later stage. But you can also have another network in where you are that can help you ensure that you not just commercialize it, but you make it effective for your own livelihood. Thank you.
All right, thanks for that.
All right, good. I want us to proceed, yeah? But before that, George is trying to join from the US. George, please come back. You just joined, and then I think maybe network issues, you left. Also, there's so many guys trying to join. Benjamin, still your network is poor, so we might not bring you in. Also, we have Dorothy Maricha. I think Dorothy is congratulating you for a good job. And also, hi, Dorothy, it's nice to see you too. Thank you for being part. And I think she's really good in terms of supporting in this COVID-19 information, sharing credible information. So that's really wonderful. So I want us to move, but there's Shikari on here. So I want, maybe she can ask any question. Shikari, can you unmute your mic? So Dorothy, she's in German, so she's sending her greetings from German. All right, thank you very much. So Shikari, can you ask your question?
No, I don't have a question, but I want to congratulate Kevin. This is job well done. We're so proud of you. Keep soaring high. I've tried the app. I've answered a few questions, definitely vague. And the first one was high. You should seek medical attention. And the other one was low. I think this is credibly good job.
Awesome. Yeah, Kevin, you have something to respond to that? It was addressed to you. Kevin, just unmute your mic, Kevin. Sorry.
Okay, thank you, Shikari. That is awesome. That's wonderful. Shikari is a personal friend, and you tried different people, and one person planned high risk, another person was low risk. I just would advise you for the the person who find high risk, please seek medical advice, because this is what the WHO guideline says. So please seek medical advice on that.
Good. Thank you. All right, guys. Let's move to Conrad. Conrad. All right. Conrad, are you there? All right. So I want to bring George, but before I bring George, I want to maybe bring Wekesa. Wekesa. My take is in terms of data, which Alphonse is alluding to, but on different surveys which I've gone through them, Kenyans don't really care about maybe security online when they are using online tools. What does this mean in terms of Kevin's product and trying to make sure that it's actually available for everyone? Wekesa? All right, so it seems Wekesa and Conrad have some issues. So Wekesa, are you there? Wekesa? All right, so I'll bring George. George, hi George, nice to see you, long time. Hi George. I can't hear you, George. I'm sorry, I can't hear you. Right. So maybe before maybe George comes, maybe I want maybe Kevin for you to respond based on various research that has been done, especially in Kenyan market, and also coming up with online tools. One of the maybe data protection is not actually the most important for Kenyans. Kenyans usually want something that works for them, easy to use, effective, and meets their demand. So what does this imply in these in your actually development?
All right, thank you, Patrick. One of the things we are just realizing right now, maybe I can just put this way: information, especially technology field, changes very fast, and people's tastes and preferences also change very fast. Just a few years ago, maybe less than 10 years ago, mobile applications was the new thing that everyone wanted to have a mobile app, an Android app, an iOS app downloaded into their phone. But when you look at things today, people don't like downloading any more apps. They say, my phone is full, they don't have memory, and they just think they have been less secure. They don't want to download apps. They think it's fishy and it's going to do something to their security or something. So they would like to use the app wherever it is and leave it there, and also come back to it anytime they want. And they have more data, more internet speed. They can access information at the click of a button very, very fast. In Kenya, for example, 90% of the population is having mobile phones, and I think a good percentage of those ones are accessing the internet even in rural areas, and they have smartphones. So I think that is one of the things that we're looking at right now that is changing in terms of technology and people's tastes and preferences. Another thing we are looking at is the interactiveness between applications. So we found that if you text people using text messages, they respond quickly and they feel more in touch with whatever kind of research or query you're trying to do. So that is something we've been implementing, and since it's been working for us. If you look at my projects on my profile on the website, you will be able to see some of those kind of projects that we've been implementing, and that have been highly successful, especially in the field of HIV research.
All right, great. I want to bring George. George, you are talking, and then your network was not was not stable. Maybe now you can maybe introduce yourself, and then we can push this discussion.
Yeah, can you hear me now?
Yeah, I can hear you now, George.
Oh, okay. I just have one question on this, and I also wanted to talk about other issues. But I listened to his name is Kevin, and he said he's using the same tracker they're using for John Hopkins. So are you working? Oh, is he there? I think he's gone. I was gonna ask him a question.
I'm trying to bring it right now. Yeah.
Okay. Yeah.
But you can just be weighing in. Maybe not in terms of the question. He's back.
Yeah.
All right.
Okay. Yeah, I was just kind of curious, like how, and I know some of the apps here, even here in US, they're saying they have this self-reporting data. Like, how are they collecting that data for self-reporting? Do those people go to the clinic or the self-test? Like, how are they doing? Like, because I'm not quite sure if they have those people who are self-reporting themselves with this COVID-19.
He's just here. Maybe you can repeat it. I think he has
Hey, Kevin. Yeah, I saw. Are you using the same app they're using on John Hopkins? Because I listened to you earlier, and you say you're using the same app. Because I have it here, the COVID-19 tracker here, the one I'm following here in the United States. I just wanted to know if you have like the self-reporting cases and how are you getting that information? Because the reason I'm asking that, I want to bring about something else about Nairobi Hospital. I saw they have, they're charging, I think, then 10,000 Kenya shillings for charging for the COVID-19. Do you have any self, reporting people who with the COVID? How are you doing that?
Okay, thanks, George. What we're doing right now is the data we are getting is from Johns Hopkins University, and it's we are using the REST API to get that information. So it's the reports that are coming in from all over the world and into Johns Hopkins database. That is the one we are querying. And then the screening tool that I have, I specifically mentioned that we do not collect personal information at the moment. We put it up there as a way to test the waters on what people would like to do. So we do not collect personal information, and as such, I leave it up to the person accessing it to assess themselves and hopefully make the decision to see a medical professional. But we have not been collecting personal information at the moment.
Okay, and back to your question, do you think the curve is flattening in Kenya based on the statistic you have collected, or how is that going? Is it trending upward or downward, or is it flattening?
The curve is still up. It's not flattening in Kenya.
Okay. All right, I think that I have, Patrick, and I also was going to talk about, I don't know whether it's too late, about the lockdown in Kenya. I was also going to mention something about Nairobi Hospital charges about this COVID-19. So I don't know whether somebody else has any question. I just wanted you guys to weigh in on that particular subject.
All right, maybe we can get them weigh in, and then you can talk about that. Alpha, we can go. Conrad, are you there? Conrad?
Yes.
Sorry, you can weigh in terms of George. George wants to we talk about that, and then so he will be talking on the same. You can weigh in terms of Nairobi Hospital and what's happening there from your own insights and perspective.
I've seen.
Done with the name first.
Yes.
Let us finish with
Can we finish
Kevin
with,
first?
Yeah,
Kevin
you can
first?
finish. We can finish with Kevin's, and then we can. Yeah.
No problem. All right.
I wanted to ask a question.
Ask a question.
Yeah, I wanted to ask Kevin in terms of now that Kenya is struggling, if you find that this app can be something good to use for the government as just as an alternative in terms of test screening, is it something that you can recommend that government rolls it out such that we are still under 20,000 cases people screened so far, and we need a way out. The same way we do registration for voters, can we have an application like this one which can help all Kenyans to do self-test so that government can approximately know what is going on in Kenya and quickly intervene? Because if we go by what they are doing, we are at less than 20,000, and it may take us a whole year to get even 1 million people to be screened.
Right.
Okay. Okay. So that is very true. And one of the challenges with COVID-19 is the government cannot easily start recruiting personnel to do the same thing they've been doing with population census or voter registration exercise. So that is the reason why we need to use something like an online app where people can voluntarily screen themselves. And from the screening data, we have something called targeted testing. So we don't just do a blind testing of everyone, but we do a targeted testing of the people who have been screened to be of high risk of getting COVID-19. So then, if we are collecting personal information which the government can do, then it's possible to actually call these people up or track them down or do something else. So at the moment, for example, if somebody got into contact with somebody who is COVID-19 positive, there is a team of testing. There's a test team that is alerted, and these people go out there to fetch for this person. So that is the same thing we should be doing with this kind of data from the app. The government can just wake up every morning and analyze the data and look at the people who have screened themselves as high risk and contact them or visit them or something or call them up. That is something that can actually help in this situation. And one of the things we have taken note of is that in Kenya and the entire Africa, not even one person, even the rich people, do not keep thermometers in their houses. And measuring body temperature is something that is very crucial to testing for COVID-19. Even in quarantine, where we have people who are quarantined, how do we get them to? They don't have thermometers, and they don't get visited on a regular basis by the nurses and the clinicians around that place. So if we had something like this for people who are in quarantine, for example, they can self-report their cases every day. They can do a self-report assessment. We can monitor their quarantine progress by way of this online tool or an SMS text message, or even if we are providing them with thermometers when they are going to quarantine, which we do not do. So those are some of the things that we are looking at the moment.
Right.
Okay, my last question then will be from the sample test, people who have tried the application. Do you have statistics which you can present to the ministry and convince them that look, these are the number of people I've tested, and so that they can follow up and see whether the information is reliable in terms of using it for COVID testing?
So I am currently consulting about that, because one of the things that we had from the beginning is that we do not collect personal information. So we like to keep this conversation, a little bit at the moment where it is, because personal information, especially when dealing with patient data, is very, very sensitive. So we do not collect personal information at the moment, and according to the data privacy policy that was published last year in Kenya, we do not do this. And we need that authority from the government in order to be able to do this, from the Ministry of Health in order to be able to do this. And I think in the beginning month of May, which we are approaching, we are getting closer to that conclusion.
All right. So, Wekesa, I think you are good. There's more questions. There's maybe you can answer a few questions here. There's one from Benjamin before we go to Dennis. So Benjamin is his network is not so good, but he's asking, are you considering actually translating your app to other languages, maybe local dialect?
Okay, I know Benjamin is in France, so probably he's asking me to translate this to French. I, that is a very good question, and I never thought about it. The only thing probably I thought about was translating it to Swahili or something, but I believe that all Kenyans somehow are used to English-speaking applications and websites. And for the COVID-19 things, we are implementing things rapidly and in quite of a hurry. So it is a step-by-step procedure, and of course, all that feedback is very, very welcome, and it's something that we can look at.
All right. So it's saying he's saying it's possible; it can be done. Huh? So there's another question from same Benjamin. Is asking about: are you considering using USSD in terms of reaching more people?
Yes, but what we are considering doing is SMS text messaging, not necessarily USSD code, but SMS text messaging, interactive, where people can actually respond.
All right, good. So I want to bring maybe Conrad's question. You can ask maybe just in a few minutes. But Dennis, I want to bring you. Maybe you can do a quick introduction, and then you can weigh in.
Yeah, thank you very much, guys. I first heard of you yesterday. That is when I saw you live, and I got interested. And today I've seen you again. And the idea that I don't know was the idea or your way is great, but I do not have a very coherent understanding of what it is as a layman, because I'm not an expert in any of these fields, medical or whatever. I'm just a businessman, so I would probably like to, as far as it seems you've already advanced, and I just, caught up with your discussion at an advanced level. If you can probably explain to me as a layman how the software that is developed can be applicable to me and to somebody in the village, because I do understand that probably it has a lot of limitations, but for those of us that can access internet and these connections to enable us access such information, where can we get elaborate information so that we can acquaint ourselves with the software that is developed? Otherwise, I want to appreciate you as he goes ahead to answer that question. You're doing a good job. Thank you.
Thank you.
Okay, is that Dennis? Thank you. So I shared my screen at the beginning of this broadcast, and in case Patrick has it, you can simply share it again.
All right.
So yeah, so what we have is what I also shared a brief history of how this came about. So we were considering doing a clinical research on COVID-19 because we thought that it's something that is going to be recurring. Maybe COVID-19 could be recurring, or we have just another kind of pandemic altogether that is just as bad as COVID-19, and we need some ways of tracking it. So I decided to put out something out there to test the waters. So I added it to my personal website and gave it that new URL of COVID-19 on my personal website. So the first thing I did was to just look into ways of providing people with live data on COVID-19, the infection rates, confirmed cases, how many deaths so far, how many have recovered. And my initial idea was to do this just for Kenya. So I put Kenya there as default. When you access the website, it straight away takes you to Kenya data. And then from there, you can also search for data from other countries all over the world, and you can see what's happening worldwide, and you can see the world statistics as well. And then as time goes by, I decided to add this screen yourself tool, the screening tool that you can see on the website at the moment. When you click on it, it's just a COVID-19 self-testing or self-assessment. And it was based on the guidelines we have from the World Health Organization, the first initial guidelines we have, and so far I have not changed it. So I did a brief explanation of what it does. So it simply asks you questions and you answer yes or no to decide your risk of acquiring COVID-19, whether it will be high, medium, or low risk. And if it is high risk, it will advise you on what to do. So I'm going to go through this quickly so that you can see, but it's something that I already did so that you can see. And then at the end of it all, it gives you a basic outcome of your likelihood of acquiring COVID-19 from the questions that you answered. And then it also gives you advice on what to do. So because this was made for Kenya, I had these Kenyans to call a toll-free line that was from the Ministry of Health. But I encountered a challenge because people are accessing it from all over the world. It's a public website. And then all of a sudden, I got questions of, what are those telephone numbers? So I had to put in there a line that says contact your local health department or authority, and specifically mention that these telephone lines are for Kenyans. So this is what I put up there to test the waters, and it's what's been bringing out all these discussions so far. So this is how it is working at the moment, and I am not collecting any personal information on it at the moment, because that is something that would require more authority from the Ministry of Health. But in case we decide to do so, it's something that is easy to do. Asking people to provide a simple thing like telephone number, and maybe asking them to give the app permission to access their location, so they can be contacted by the Ministry of Health if they are high risk and get tested. So what this is about is not a diagnostic test. It is not a test. It is a screening tool. So a screening tool, what a screening tool does is that it identifies amongst the population. It identifies the people who are supposed to be tested, so that we do a targeting testing instead of a blanket test of everyone in Kenya. That is the idea.
Okay. All right. So maybe Dennis.
No, thank you. I will continue going through the explanation or the notes provided to learn more, but I am satisfied with the explanation demonstration that is already executed.
Right, good. Thank you. I want to go to George. George, maybe in terms of what Kevin is doing, especially now when we are looking to countries like the US. Do you see this working, especially when we do targeting screening in Kenya?
Do I think is working? Is that what you're asking?
Yeah, I'm asking, do you think this can work in Kenya, especially when we are talking about mass screening, where we do a targeted, segmented population? Maybe we say these people who are done this self-screening, they are the high risk, we go to them, instead of maybe picking people in the streets and testing them.
Yeah, I think it can be done, but I think one of the problem is just like the access to the internet. Not everybody who can be able to get the internet, work on mashinani. I don't know how easy they can be able to do that. Because even here in US, some people, it's still a problem when it comes to the tracking and everything. So it's not easy, but that does not mean it cannot be done.
All right, good. All right, so I want you guys maybe to continue, maybe Alphonse to weigh in terms of where we have reached. And also before you do that, Dorothy from German, she's saying she has used the app and she really recommends, she has used the website and she really recommends the website. All right, Alphonse.
Okay, Kevin, I am still interested in your product, and part of it is, are you having just a website, or is it also an app? Is it a mobile app as well?
No, it's also my personal website. It's not an app.
Okay, now I've been able to get some information just on your domain. You registered this domain towards the end of October last year. COVID was not even there at that time. So how did you integrate? What were you anticipating COVID, or how did you put COVID into this project altogether? When did you start this project? And how did COVID enter into it? Because 26th of October, there was no COVID anywhere in the world, according to the reports we have.
I was probably one of the first Kenyans to try alerting the government of COVID-19. On January 22nd, I think January 22nd, January 23rd, I sent a tweet on Twitter alerting the government of Kenya about how a virus outbreak in Wuhan, China. During that time, there was only 20 deaths so far in Wuhan alone, and one confirmed case in the United States. But I tried to tag Citizen TV, NTV, all those time stations, and nobody responded. Nobody responded. Somebody actually responded and told me, "You should know people." so it's something that I did try to send a warning, but it did not work. Now, the website, I registered it last year, that is true, because it's a personal website, it is mine. And when the COVID-19 pandemic came up, I just decided to add the COVID-19 link to the URL that I already have. So that is how it came up.
All right.
Okay, are you anticipating to have a mobile application and then integrate it to the website in the long run?
I think that is a good option. And I have had discussion with somebody from Accra, Ghana, where they have implemented a mobile application for the same thing we are doing. I have done here on screening. So this guy called me up and asked me, how does this work in your place? Because in the government of Ghana actually launched that app on TV, and nobody seems to be using it because most of the feedback they're getting is that people don't want to download an app. People don't trust applications anymore or something like that. But it is still a good idea to have an app that is associated with it. So I would say if you want to have an app, you should also have a website for it as well.
My own request for you is now have a business plan or have a plan for this type of work beyond what you are currently doing. This one is a bit of firefighting, but you have proper brain. In my assessment, listening to you, you also have an advantage of age. So whether people like apps or not, they will still, once it becomes a necessity, they will actually pay for it to use it. So don't worry about that. And if they don't like the free one, then the price must be higher when now they have to. If they have a choice and they don't like it, when now they have to, then the only thing they can know that next time they should adopt it earlier is give it a higher price. So for me, it's a good solution as you develop a business plan around it. Get some assistance if need be, but listening to you have what it takes. You have what it takes to initiate everything, and then the rest can be built on board while you are moving. So build a business plan. Don't sell more than 25% of this idea if you are to sell it. If you want to register it, get a name, register it, patent the idea in collaboration with an advocate of the High Court in Kenya, so that you start from Kenyan space as you move along. there is no rich person who started at their 40s. Anybody whom you admire today successful in their field, the idea was clear either when they're in their 10s or they call it teens, or when they're in their 20s. So 20s is usually the place when we develop a lot. If you start in your 30s, again, it's a special type of struggle. In 40s, you will manage life, but you will not manage success most likely. So most of the successes come when the spirit is inbuilt from the 20s. So I think you have that advantage. Majority of us will discourage you. Majority of us will not see where you are going, and therefore will not see the value, because you are likely to set something that you have not seen before. So my encouragement is put yourself ready to be alone along the way most of the time, but you'll get strategic friends, people, and partners in strategic positions that you need to make strategic decisions. So don't listen to majority of us by discouraging you. Listen to the few that will encourage you. If I'm not in it, just proceed.
Thank you for that, Alphonse. That is really, really overwhelming. Thank you.
Good. So I have more questions to address, Kevin. So of course, Dorothy, she was actually addressing George, who is in the US, when George was talking about Kenyans don't have phones, maybe, but maybe from reality, Kenyans have the number of smartphones are increasing in Kenya. But since he's not here, he might not be able to respond to that. There's another question from Washington Osiro. I think he's in the US. Is saying, how is your data, your information you are collecting, aligned with the information from the MOH?
Okay, so the information we are collecting is aligned with the WHO guidelines, which somehow I would say supersedes MOH, but the MOH actually also tries to follow that guideline from the WHO. So everything we're doing is from WHO. The indicators I have put on the website that I'm tracking are all based on the WHO guidelines as well.
All right. So maybe to follow up on his question, is it are you planning maybe to put cases for Kenyans, like different regions, like Alphonse, what he was saying earlier?
Which has been difficult because Kenya does not have that kind of data. So we report a country as a whole, and we've not been reporting it from the different regions we have. But there is a research coming up, which we are working on, and if that succeeds, then we will be able to locate Kenyans more, locally than we are doing right now. Maybe generally from the sub-county, from the lowest administration level.
So we have another one from Washington Osiro is saying, Alphonse, you are spot on in terms of patterning the idea. So good thing, Alphonse. All right. So now Alphonse is also asking, Washington is asking, is there an opportunity for synergy between your app and MOH? Are there opportunities?
Yes, there's an opportunity. We are working on it right now.
You're working on it. So you are in engagement with MOH?
Yes, we are in engagement with the Ministry of Health, but it's from an organizational level. It's something that we are looking at.
Wow, that's a good thing. Yeah. So I want to bring Wekesa, but Wekesa, maybe I want you to weigh in terms of now what we discussed earlier. We were talking about going forward. We are looking at the future post-corona, because Kenya has been having so many issues, maybe from non-communicable diseases. We have issues to do with the double burden. We have so many issues, especially in healthcare. Now, looking at Kevin and what he's providing, what kind of solution should we look at and also ask him to provide for Kenya moving forward? Wekesa?
Okay. Yeah, I think this is a good progress, and we want it to be effected in the Ministry of Health, because we realize that we have a lot of gaps in terms of even getting data of what is happening in the ministry and in regards to different diseases and the programs that are running, the immunization programs, and some of the epidemics that we have had. And like we said, we need to develop intelligence system so that our information is sustainable, and part of what we are doing, we use the experience we have had in the previous season to improve on the future eventualities, because I'm very sure that COVID is not the last disease we are handling. Other challenges, other diseases will come, and our first response will depend on how we on the improvements we made in the challenge of COVID-19. It has provided us with an opportunity to reflect, to research, and to develop. And such applications are there to give us the information and to give us to hold sustainable information such that in the next dispensation we will be relying on what we gathered, what we improved, the gaps we sealed, and the strategies we laid in terms of combating such diseases. We need technology going forward to be our first line of defense, that if we had already known something like this, perhaps we could have used it, if we used it only for our own people who are traveling out and inside Kenya, we would have known who are the high risk guys and probably dealt with them. You can imagine we had the 239 guys who came through one of the planes. We were told they went for self-quarantine. We didn't have a feedback from them. Perhaps if we could have had an online way of even engaging them, we could have got the feedback that out of the 239, maybe 20 or 40 were at high risk, and they would have reported to the ministry for further checkup. So this is a good step, and we encourage it to. We encourage the idea, and we want now you to develop different application in to combat different challenges that are affecting the Ministry of Health. So your engagement should not be just between you and the Ministry on COVID, but on all other health-related challenges that we are facing as a nation.
All right, thank you, Alphonse. Maybe right. So I want to bring up, but I have there's a question from Washington, but before that, let's bring Conrad to ask maybe his questions and his perspective.
Okay, my question was about the fever part, the temperature part. We know part of your self screening, it has the temperature part. People being asked the temperature part. If their temperature is high, the fever or something like that. So my question was, are you planning to integrate probably it once you start geolocating the people using that the people using a website? Are you planning probably to start now geolocating, seeing where the risk area is in terms of people with or something like over than above temperature? Because in Kenya it can be hard because we don't have, as you said earlier, people, even those one who are able, don't have thermometers in their houses. So are you planning to probably integrate it, use it something like clinical or something like that, the same way you're using the self-screening tool there, so that you integrate it with to come up with something like a fever map showing where people with slightly higher than normal temperature, where they are coming from. And my second question concerning the same, with the engagement with the Ministry of Health, they are collecting a lot of data also on temperature, because right now as we travel, we come across several roadblocks where your temperature has to be measured. So are you planning also assisting them in terms of trying to use that information, that rich information they're collecting everywhere, to come up with something that can be able to show them or direct them in a specific direction, just generally, and probably to ensure that they have something like a more targeted approach in this?
All right, Kevin.
All right, thank you, Conrad. So the temperature question we already answered. No, sorry, we already talked about it, and I mentioned that in Kenya and in Africa in general, nobody seems to think about thermometers. Even the rich don't have thermometers in their houses. So measuring body temperature is a vital part of testing for COVID-19. And it's going to be a challenge. It's been foreseen. So in my other engagements, we put that as part of the measures that needs to be taken by the Ministry of Health. If you're putting people in quarantine, you need to provide them with thermometers, so at least they can report their daily quarantine progress using the thermometers that they have. But at the same time, to answer your question about showing the areas where people with high temperatures are coming from, yes, I have been engaging a group of people called ArcGIS, which they generally deal with geographic information systems. And a good news here is that they give me a free pass for a 6-month license for GIS that I can use specifically for COVID-19 related issues without having to pay for it, which was great, great news. So that is something that I'm also looking at, and it just adds to the positive energy that is coming out from very many different sources.
Great. You have something else? All right. So,
yeah, I was just asking about also with the engagement with the Minister of Health, because part of the new measures they're taking into place is temperature screening. Like all over, you walk around all over, people are being screened temperature wherever they're going. And now even it has been added as part of the mandatory things to do if you are entering the hotels and restaurants currently. So are you planning somehow to try to use your website or your other application to ensure that such data is captured, so that it can be able to assist somehow in analyzing the situation we have currently?
Okay, so I've also seen that, and as I was walking across different malls, they measure my temperature, and I keep on asking them to show me what the result is. Fortunately, it's been constant for me. It's not been reducing, it's not been increasing. But I think that is a good way of measuring this temperature if we don't have the thermometers. So if you go somewhere and somebody screens for you for your thermometer, they should also be given that information that, you know what, can you just visit this website and report your temperature if they find you to be high. I don't know what they're doing if they find somebody who is above 37 degrees. I don't know what they do. I did not ask them. But I think it's something I'm supposed to, I'm going to do next. I'm going to ask them, what do you do if somebody is more than 37 degrees? What do you advise them? Do you just turn them away and tell them, no, you can't enter this mall? Or do you advise them to do something else? In which case, I would prefer, do you advise them, if there was some online way of reporting themselves, like the one we are discussing right now, that would be so great. But I don't know what they're doing at the moment, but it's something that we can check. And I think I like that idea of measuring someone's temperature. You find that they are more than 37 degrees, and then you just advise them, hey, go to this website and report yourself. Something like that.
good. Thank you for that. So there's maybe this question should be appropriately for Alphonse. Alphonse, Washington Osiro is asking about the Nyumba Kumi initiative establishment in Kenya. Do we have a very robust Nyumba Kumi initiative across the country?
No. Nyumba Kumi initiative is not robust in the country. except where we have had incidences that have pushed the locals to organize themselves. I'll give examples. In the rural areas, people know each other, and any new person is known, and any new thing is known. In my own village, even if I was to sneak at night, there is a time people don't walk, so they only expect few people to be on the road, or so they will know that somebody is walking here, and that walking style is not the normal one. And I can't sneak at home because it is a tightly knitted community, but it's not necessarily a Nyumba Kumi initiative. It has been there even before the Nyumba Kumi concept was brought on board. In towns, we have gated communities that almost know each other because houses are well spread and known. But also we have the slums where locals or residents don't know each other due to the nature of life they live, and they are congested. There are many. They work hand to mouth. They leave when it's dark. They come back when it's dark. So you find people live 2-3 years down the line that don't know each other. But since Nyumba Kumi initiative was started, that has addressed a few issues, or it has been addressed in a few different ways, so that even though the tenants don't know each other as much, but the landlords have teamed up together in most of these slum areas and low-end life suburbs, so that now, like where I stay, I know we are organized in streets. So that street, you find that where the street we are in, landlords know each other. Then they have one person being their chair for that year. Then they have rules that govern that street. So if they need security, they know how to organize the security for the street. Then now it's the job of the landlord to ensure that if the tenants are involved, they ensure their tenants are involved. So they enforce that, and it's working. So, but in terms of tenants themselves, they don't know each other. But at least there's something happening. It's a longer process than I expected initially, but the process is not yet elaborate in terms of functionality. But in terms of the concept, the idea behind the concept, that is concrete. It is implementable, but still needs a few logistical issues to be addressed. Now, in relation to that, Kevin talked about how to map the area, or rather, we have the issue of mapping the area in Kevin's product has been coming out. I think what Kevin can start with is to start with the sub-counties. That's already established in law, and it's easier to know them. So in your work, robust working is you do it in advance, not necessarily even for COVID-19, but for future reporting. In very many other things that you want to report, some majority of it should be health, so that we look at you from a health informatics level. But you can also decide to do that from other things. Now, while doing that, I want you to think through the structures that the country has in relation to CHVs, community health volunteers. We have the community health workers, but also we have the community health volunteers. Now, the community health volunteers, I think that the majority of the health workers at the community level and in the entire country, from the community perspective and the health perspective, they are structured in the sense that they have a coordinator in each and every sub-county and in each and every county. So once you understand their structures, it becomes easier to use that to know how to be getting reports, because these are people that even if you are to get support, and I know you can get support funding, in this case, externally or internally in the country, you develop structures around these people because they are able to give you grassroots reports real time. So even though you may not have everybody reporting, but these are the eyes of the government on the ground. If you're doing immunizations, if you're doing surveillance like now, if you are doing community civic education on an issue health related, they are the eyes of the government, they are the legs of the government, they are the hands of government on the ground, and therefore think about them. But in terms of geography and restructuring how to report geographically, think about the wards or think about sub-counties. I think it will be easier in that direction.
All right.
Yeah, thank you for that, Alphonse. I think we discussed that anyway. What sub-count? I think that's the same thing, right? What sub-count?
Not necessarily.
Okay.
Yeah, but I think it's general consensus that we can work with the lowest administration level because of the Kenyan address system is not well established. So the lowest administration level can work in this case.
All right. Good. But anyway, I want to push this question, Conrad, because when it comes to CHVs, community health volunteers, Kenya has over 18,000 CHVs across the country. But Conrad, I want to understand when coming up with the issues of credible information that CHV is correct, what is your take on this?
I think Kenya's CHV, we have a robust CHV network in our country. The only problem, I think, they are not incentivized to do their work properly, because I'm sure even in our village, I've seen our local CHV who has been there for a very long time, walking around informing people how to do they need sanitation and the rest of the things. So in terms of CHV network, it just depends with the area and how, if the public officials are activating them, because the thing is, for them to be able to do this work, they need someone to be able to show them the direction, say, start doing this. Some are active, some are inactive, depending on their level of engagement in certain issues, because most of them are normally used when it comes to certain health matters that come up, maybe surveys, maybe certain studies being carried out, maybe a certain project is ongoing. That's when they are normally activated, like times of polio vaccination, things like those ones. You find them being activated to ensure to help the health workers in terms of that. But we need them to be always on alert, to be always activated, and it's up to, I'm not sure if they are given anything to motivate them, but it depends. I've seen most of them, because I've seen from experience, most of them, the places where they're active because they have other engagements outside the health, outside their normal mandate, that probably gives them income, that gives them some motivation to continue on. So in areas where there's a lot of project health related projects, you'll find some of them are very active because they're always engaged in such issues. In areas where the such project or such studies or something like that is very dormant, or the place is very inactive, you hardly see them working. But it is a rich network that can easily be activated. Also, I'll just ask, my other question was just to Kevin, a bit of it. In terms of temperature, we know that taking temperature, knowing if you have a fever, it's hard if you don't have a thermometer, but you can have either some, like the way self-testing, the way you are doing here for COVID, where somebody can fill a certain questionnaire to show if they have a fever or not, so that to ensure that thing can also be captured clinically in case somebody does not have a thermometer.
Right.
Okay. Yes, and I think it is captured. The fever, some of the fever questions are captured, but the body temperature question is also added in there. So just like everyone has taken initiative to purchase masks, I think if our government was smart enough, they could have also taken this initiative to provide, cheap thermometers for people to just purchase and on, just not just for COVID-19, but for the general sake of healthcare for the entire public. This is something that is just we are learning, and this is how countries implement changes in their healthcare systems and improvements. So we should learn from this COVID-19 and know that what, everyone should probably have a mask in the house. They should probably have a thermometer in the house. It should not be that expensive to have a thermometer.
All right. Good. Thank you. There's a question about, is there from Washington, Ausilo, is there a doctor's online panel who have prescribed hydrochloroquine? All right. I think no. So I think that one I can answer no. Is it? Kevin, maybe you can weigh in.
Can you repeat the question?
Yeah, he's asking, do we have in this country a doctor's online or panel where they have licensed prescribed hydrochloroquine? Hydrochloroquine is banned to be used locally, especially on issues to do with COVID-19.
No, I have no information concerning that.
All right, good. So currently, maybe in the country, we don't use that because it's maybe not legalized at the moment because there is no maybe trials done on the same. What
I
our post.
think I I think on the issue is only that the Minister of Health is not sharing that information, and we are not privy to such details. But from there are so many other drugs being used in our local Kiswahili say chinyamaji, which we don't know. But I think during one of the first press conferences earlier on, I think it was Dr. Amoth alluded to an issue. I'm not sure if it was chloroquine or hydroxychloroquine, which was used in a certain patient, and it showed some improvement. I'll counter check that, but I'm very certain that in one of the earlier press conference he alluded to that very early into this. He said something like that. It was alluded to. So I'll just counter check and see the exact date he said that. But I'm sure he said that in one of his press conferences. There are so many other trials that are going on, so many other things that we don't know. Yeah, I think you need to get doctors, especially these folks from Aga Khan and KNH. They're doing these things and they are not communicating to other people. They're not communicating to us. We don't know. But there are so many other things they are trying out that we actually are not aware of as a country.
Good. So yeah, he's saying there is an opportunity to perform retrospective clinical study to see how effective it is. Of course, even specialists, maybe professors have been really pushing for maybe trying it, but I think since today there's no doctor in this panel, especially practicing in Kenya, so we will not go to details of it. But anyway, it's true. We need to maybe try it. All right. So there's another comment from Dorothy. Dorothy, she's saying in German, everyone has a personal thermometer in the house. Dr. Amoth said, yes, they use hydrochloroquine and Z-Pack. I think azithromycin, which is, I call it usually Z-Pack, and some patients and ARVs. All right. So, Conrad, I want you to weigh in terms of what Dr. Ahmad said. Actually, there is a combination of the same. Is it?
Yeah, he actually said that one time during the press briefings, he talked about a patient. I think it was it Nairobi Western or Kenyatta? I'm not quite sure where the patient was, who has shown some remarkable improvement after administering that. Then he mentioned it, but it's still early to say the efficacy of such because it's just one case. But I think they are using that, and they have other drugs that they are using. I've seen several people talking about some drugs that are under trial in Kenya. But the problem with this is that we have a very small pool that needs such, so we can't really talk about much about it. It's just like we don't know where these people are admitted. Some of them are admitted in private hospital, probably they were used there. Some of them are the public hospital. So we don't have much information about that because of the small number of cases we have, and so many other treatment regimes the doctors are trying on these people. So I can't comment further because I don't have much information concerning that other than what I've heard in the media and probably what I've also seen some of the doctors talking about in social media about some of the trials that have been done in Kenya, that some of the drugs that have been tried in some patients in Kenya.
All right. So maybe we have to mention that basically in terms of these drugs is not actually because the Pharmacy and Poisons Board, which is now regulating it, is not actually recommending to be used currently. They might have been tried, but is not being recommended. All right, so we can move forward. So maybe let's talk about telemedicine and the future. And this is the last maybe topic we can talk about. Now, Washington was saying about maybe online prescriptions in terms of certain drugs, prescribed drugs, maybe on online platforms. Do you see, Kevin, us reaching at that point where we can have prescription drugs done online?
Yes, I can see us do that in the near future. And just to mention a little bit about that, I've been associated with the University of Kansas Medical Center for a while now. And since the outbreak of the COVID-19, they have been giving us a few training on telemedicine and how to have something we are calling it a Zoom encounter with patients. But it's taking in Kansas City because of this COVID-19 thing. But it never used to be there before. So it is something that we can also do here in Kenya. We have not reached that stage of even doing something we call, we call this point of care, you know, health service. We do not provide that fully. We do not provide point of care health service fully when it comes to medical or technology at the moment. What we do is we treat patients the way we do every day. We record things on paper and then transfer the information to electronic medical records after that, which is not really real time. But if you can implement point of care successfully, then of course you can also advance to telemedicine. And in one of the projects I'm working on, we've been doing a little bit of telemedicine, which is not really the ideal situation of what telemedicine is supposed to be. But to give you an overview of what we've been able to do is have a doctor in the United States examine an X-ray that has been taken in Kenya through an online channel. It is a link that we just set up and use it in a short period. And then when the session is done, it is destroyed and everything that is there is taken out. So one of the biggest issues concerning this telemedicine is also, information security. So privacy, security of the patient data and information, that is something that is very, very important when you're talking about telemedicine. You have to set up a very, very secure channel, which we've done it, I think, 2-3 times now, not many times. But we've been able to interface with doctors from the United States and have them examine and give us a second opinion. And this was on a cancer project.
Awesome. So, Conrad, can you weigh in terms of maybe prescription? Kenya has been really avoiding that conversation about telemedicine, especially when it comes to prescribed prescription drugs.
I think we have there are so many other. I've seen like one application that has one startup that was trying that telemedicine in Kenya. It's called Ozimo or something like that. Was trying that. I've seen it, and I think it's not that we don't. I think they are trying to do it because part of what I was talking about early is when Uhuru Kenyatta was talking about launching what is it called, these things, Google whatever, Google loan, when he was talking about it coming to Kenya sometime this year. One of the things that was informed that decision was interconnectivity between different county referral hospital and the national referral hospital, that is KNH and MTRH. And part of what they did after that was to launch a telemedicine center at KNH. Is it KNH? Yeah, at KNH, which I think the understanding what I think Kevin was alluding to, what he was trying, it was also the same thing they are trying to do to ensure that the CT scan, the X-ray can be able to be interpreted with specialists, where if they are taken somewhere, because you have this equipment strewn all over the county, but they don't have the necessary personnel actually to be able to interpret such. So I think they are moving slowly towards that, and I'm not sure the progress because some of these things we are not aware of the progress they are making because they never talk about it unless somebody inside there can be able to tell us what is their way forward, because they only launched one, then things continue underground, but we are not aware of it. But I think that is part of the reason, and one of the things they are doing was fiber connectivity across different parts of the country that are connecting referrals
All right. Conrad? All right. Sorry, it seems we are losing Conrad because of maybe his network. Alphonse, you might be privy to some maybe sensitive information. But anyway, in terms of telemedicine, Kenya, the issue is Kenya has tried telemedicine, we agree, but we have not tried prescription, maybe drugs, right? So now, do you see us getting to that?
You know, in technology, there's something called adoption. And adoption starts from what we call a sluggish process or sluggish end. Then it will start increasing slowly. And it is the same curve that we're talking about. So then the curve will start increasing at an increasing rate. That means increasing a number of adoption. People will adopt it at a faster pace, but once they have seen it working with others, so the people who want it to start, the initiators always go through the process of it's difficult for people to accept. So the question is it something that can work? The answer is yes. Therefore, the only issue is that when will it be fully adopted or majority adoption will happen. So if you are in that space as a person and you are listening to us or watching us, run very fast and become the first people. The early adopters are always the millionaires in the process. Yeah, because you do it before it is flooded. When it gets flooded, you actually leave it and do something else. So for me, telemedicine will happen. It's not if it will happen. It's when will it be optimally adopted, because already adoption has happened, but it's not at the optimal level. Yeah. So the earlier you adopt the technology, the better. Now, there are issues about security of data security, and I think Kevin was talking about that, particularly now that they have been trying it out with other people outside the country. I have worked in the banking sector, and I'm certain, without asking a question, that each one of you has a bank account. Now, have you ever been worried that your money will get lost in the bank, even if you hear that the bank was robbed? The answer is no. Why? Because the banks have adopted what we call security measures. Now, apart from the banks, we also have other payment solutions, and I want to give two examples. One is PayPal, and the other one is Visa or MasterCard, who deal with the cards themselves. Now, again, if you are doing your payments online and your payment is done through PayPal account and you pay the PayPal, then you transact from PayPal, I'm certain you have never had a problem thinking that your account will be hacked into. Or if you're using your Visa platform on an ATM of another bank in another country or the same country, you have never been worried about, because the measures on security always are increased when you start using or once you have adopted. So you cannot enhance it before you adopt it. I am a specialist of ATMs and ATM cards, and I was involved in the adoption or change from the magnetic strip cards to the chip and pin. That adoption when we were changing it, and I was involved in 5 countries in Africa, and people were not sure. But today, you cannot imagine using the magnetic strip again. And you see, before, what happened in 2012 that made every country come to that decision, and every major player, and that was MasterCard and Europay, China Union Pay, Visa, and American Express. What made them come together and agree that we must have a security feature for all our customers is because there was a fraud, a global fraud for 3 weeks, yeah, that swindled money in their platform, and they had to pay the money. So where I stand is telemedicine is not an option at the moment. It's a must. It's a mandatory. So the question, if we will lose more if we become late adopters. That's what I can say. So I expect us to adopt it.
Sorry, we lost Kevin. So I'm trying to get him back as we finish. Dorothy, she's saying she's practicing in German, and actually they are using medicine, and it's working there. So if it's working in German, also George practices in the US, it works in the US, then absolutely it needs to work in Kenya, right? So we agree that. All right. So and also Washington Osiro was saying that this is telemedicine is a regulatory and security of patient issue or privacy of their data. Yeah, we agree, but we really need to have maybe secure systems that actually warrant guarantee that. Anyway,
The question you need to ask is, assuming you don't have telemedicine, when I walk and see a doctor, how is my data secure? Who secures my data? How is it secured? Because it is actually who keeps it and who takes care of it. Now, once it becomes the hospital's responsibility to take care of my data, then it is that system we use that need to be controlled. And there must be people in charge of that system. Now, banks that I've used as an example, because they're the most advanced, the financial systems are the most advanced in terms of security features online, they don't own those systems. There are third parties who provide that. So those third parties have mechanisms of ensuring that the security of the data involved, this customer data, is extremely secure. So that even today, if you call your friend or your spouse who works in a bank or a financial institution to tell you about account number of somebody who owes you money, the person has your 1 million, and you are aware they did something recently and they were paid. So you want to confirm if the money went to that account. Even if it is your spouse, they can actually access the account. But if they tell you, if that person complains when you approach them and they suspect, the bank has a mechanism of confirming if that person went to that account. Now, one thing that they will do is that you only given rights, and those rights are supposed to be used only when need arises. You cannot check a customer account if the customer did not make an inquiry. So if you are found to have viewed the account and the customer has did not come to your station to ask for the information, they didn't ask the information on email or any other platform provided, then the question that you must ask is, what took you to the account? And part of the discipline measures is, one, you are dismissed from your employment. But two, you also risk being taken to court, not just you as an individual, but also the organization. So because of those measures in law, policy, and practice, things have been enhanced. And we cannot enhance them until we start it off. So I think our health data is supposed to be safe and secure, but we should not hide behind security as the reason why we are not taking the information. Our information is with KRA. Our information is with the Registrar of Persons. Our information is with the Immigration Department. It's with police, for that matter. So we are not hiding it. It's just supposed to be confidential, not to be hidden.
Yeah, good. Yeah. So Kevin, I want maybe you to comment in terms of what role that the youth need to play, especially now in this season, and especially after post COVID. What are we looking for the youth to provide solution for the world?
Thank you, Patrick. I've been seeing you championing the need for the youth to come out during this quarantine period, and COVID-19 crisis, because crisis shape countries. So the youth should be more innovative and spend time doing more, creative things other than just sitting around and doing nothing at home or watching. I also do watch like Netflix and whatever shows that are happening out there, but so just for a few moments. But then most of the time I just find myself, in quarantine, yes, but busy doing something that at least you try to save lives, whichever capacity, whichever skills you have. So the youth should use their skills and try to save lives during this crisis the best way they can.
Awesome. Great. Maybe Conrad, you can weigh in terms of the role of the youth going forward, and especially now and maybe post-corona. What is the space for the youth to play in terms of providing solutions for the world? Conrad? All right. I'm sorry, Conrad is saying his network is very unstable. So we'll go to Alphonse. Alphonse is very passionate.
Intelligence.
Oh, sorry. You can go maybe. Sorry about that. Conrad? All right. Sorry about that. So Alphonse, maybe you can weigh in terms of the role of the youth.
Youth is 35 years of age and below. And so we are almost clocking 75% of the population. So this population is youth. So I don't understand why we are discussing youth as a separate entity. We're supposed to be talking about the aged, those who are not youth, to be the ones that, how do we include them? Now, what is clear is that we will not be given anything. We will not be given opportunities. We will not be given a chance to be the leaders, whether in politics or in career like medicine or farming. We must take our position properly. Now, how do we do it? Every youth should be armed with a skill. Have something you can do. Yeah, you can actually, you understand crop farming or bean farming, so that if you are given a farm and money, you can do bean farming. You can do, you can take care, yeah, of a business. You can manage a department, yeah, because you have a skill around that department. So what do you have? Because the truth of the matter is, we will be crying saying that we were not trained to do it, yet we also lost the opportunity to do it. Now, most people who do the right things were not taught to do the right things in school. So it's not about the academic system, education system. What do you want to be able to do? If you want to be able to be a piano player, you can actually learn it online. Yeah, you can. If you go to a church, you can learn it there. If there's a music school around, you can visit them and just start learning from there. So, what skill do you arm yourself with? Because we have a bunch of young people, majority of whom are actually educated. Education here means have at least Form 4 certificate and above. Yet there's nothing they can do in person. They are the group that say, we can do anything. I don't have a job. Give me anything I can do. If you can develop a website, then we can give you a website to develop. Yeah. If you can actually train children, then we can think of how to manage your work of handling children and where children are and the need of children, and we connect you in that direction. So first point of defense is, every young person, I want you to be prepared to do something. But the truth of the matter is that not every young person will be skilled. Yeah, but every young person requires an opportunity. So those of us who are in a position to provide that opportunity, in terms of, we need hands-on people. We must create these jobs that actually also take care of these people, so that they're also productive in the economy during their productive age. So policy, what policies are we putting in place that govern so that it is pro-youth and in action, not just on paper? For example, the 30% youth tenders, yeah, it doesn't work. The people who own those processes are older people, because you are told to, for you to get that tender, you must have specific amount of money that can do it. That money you must have invested somewhere and over time, which you cannot get it when you're below 35 in some of the jobs you are given. So what happens is that you get an old man who is part of the system, and they don't like the system to work well. So they tell you, you tender it out on your name, I'll give you everything, and then they will ask you to give them even the cash in hand, because they don't want transactions to be traced. So I think young people, rise up. Don't beg. We only beg if we decide to be in the back seat. Why should you beg when you're the majority? Why should you beg when you are in the driver's seat and you are asking the people at the back seat to be the ones driving the vehicle? This country must be driven by us, will be driven by us, and should be driven by us. Now, to government, just a quick one. COVID-19 taught me something, that government still knows very well that young people are the key drivers. Whether you're telling us to sit in the house, it is the young people who, when they sit in the house, everybody will have sat in the house. If you want us to to support government initiative. If young people support it, it is supported. Now, I didn't understand why every person involved in policy making, decision making, control of resources is not young person. Then young people are told to support. That is playing with our minds. So the government should know that we are tired of that. We are not going to entertain it. We will use all means possible not to entertain that. But the best thing is they should give us leadership they have given us at our homes by letting us know that we can do it. You cannot learn outside the system. You must do it within the system. Until we start it, it will never be done by us. So give us that chance so that you don't recycle people who are past retirement age, past 60 years of age. Why do we still need you to be the main person? You can be the person holding our hands, but being the main person in every aspect, and you are 70 years, 75, I think that is very unfair for the young people.
Right, good. Thank you very much. So before we finish this, of course, Kevin is taking us home, but I want to read the perspective from Washington Osilo. Is saying, as the oldest person on the panel, my advice to the youth is to execute on the most basic interpersonal and moral / ethical skills. Punctuality, respect, honesty, follow through on the commitments. Choices that reflect your beliefs, including the ballot box, until a critical mass of the youth start embodying the values they talk about, not much will change. So it's actually calling for the youth to be on the forefront, actually doing, and also maybe having interpersonal skills and actually participating on these maybe political issues, maybe also voting, choosing leaders that maybe are good for our country. So that was it for our night. I want you, Kevin, to take us home.
All right, thank you so much, Washington Osiro, for the elderly guidance that you just provided there. And I also like Alphonse's comments. This is just viva, viva, viva all the way. I mean, it's a resistance. It's like a resistance message that is just coming up right now. But the key message is crisis change countries. And many industrial governments that we are seeing, that developed countries we are seeing in Europe, wherever, those guys went through a tough time during the World War II, and they emerged from it stronger than ever. So this is something that Africans we do not know how to struggle, where we are begging, we depend on assistance from elsewhere, and it's been taking us down the road for a long time. We need to learn from crises such as this one. When our politicians can no longer afford to go out of the country for health services, this is the time we need to improve our healthcare. Health is a very important thing. It's key. It's vital. I have been taken over by health. I'm not a medic. I'm not a health person like a nurse or something. But in my neighborhood, people think I am a doctor. I'm not. The thing is, this is important. The message is health informatics, and everything that I'm doing it to save the lives of people. And that is just my passion. But I don't know what yours is, but I think everyone needs to just follow it to the last.
Right, great. Thank you. That's a very wonderful way to end it. Also, thank you very much for every good messages we received, especially from Washington in the US, Dorothy, and for the support. You guys, see you next time. Good night, everyone.
Bye-bye. Thank you.
All right, good night.
Okay.
Nimejaliwa moyo wa upendo, ukipenda napendaga vibaya. Ile skendo zimefanya sijasetwa mademo nikuwa vibaya. Nimeshabadili hata mienendo, nadai nafuria mbaya. Sifanyi kiki tena na skendo, sina nazo kisawe mama. Wananiita playboy baada kitendo nasema wenye mimi hata kama na watania. Wananiita playboy baada kitendo nasema wenye mimi hata kama na watania. Baby, mi so mtu mchezo cheza. Na bite, oh yeah, talewa. Na bite, baby, mi so mtu mchezo cheza. Na bite, oh yeah, talewa. Na bite,